everybody, welcome back. It is February 2024, and this is our first presentation in our new series called Caring for and from the Heart. This week, we have a presentation by Sarah Bakke, who is going to share with you the differences between complementary care, integrative care, and alternative care. And she's going to share with you some strategies and some barriers that you might encounter when trying to implement these in your NICU. So I really hope that you'll enjoy this presentation by Sarah Bakke from our 2021 conference. It is an amazing review of the literature, helps us to put all of the practices that are possible into context, and gives you a roadmap for implementation. If you haven't already, what are you waiting for? Go ahead and subscribe to our YouTube channel. It helps us bring you more free content. Also, go ahead and scan the QR code on this screen or click the link in the show notes below, and you'll be taken to a page where you enter your email address, and you'll be able to download the slides for this month's presentations and get reminders every week. So without further ado, I hope you'll enjoy this presentation by Sarah Bakke.
All right, welcome back, everybody. I'm going to introduce our next speaker. Sarah Bakke will be presenting on complementary therapies in the neonatal intensive care unit. Sarah is a recent graduate of the dual acute and primary care pediatric nurse practitioner program at Drexel University in Philadelphia, and is an acute care nurse practitioner in the cardiac care unit at the Children's Hospital of Philadelphia. Sarah was a NICU nurse for 10 years and led a number of neuroprotective initiatives, including launching a language nutrition program, founding a multidisciplinary neuro-NICU committee, and completing an evidence-based practice fellowship. Sarah is passionate about the power of nurses in optimizing early brain development. So let's welcome Sarah.
Thank you, Lauren. I'm so excited to be here with you all. So I'm going to be talking about complementary therapies in the NICU. So here are objectives for today. I wanted to start with some broad definitions and concepts to get us started. And then we'll be discussing complementary therapies in the NICU and going into some details on the safety and efficacy, what sort of benefits we might see from using these approaches, and then what are the barriers that exist to implementing them. I'll present the NEO-CT survey, which is my survey project, and discuss how and why I developed the survey and share some preliminary results. So I want to start by briefly defining some terms and discussing the role of the National Center for Complementary and Integrative Health, or the NCCIH, in the United States. So generally, people use the terms alternative and complementary interchangeably. However, these terms refer to two distinct concepts. So complementary health approaches include non-mainstream practices and products together with conventional medicine. So for example, if you're incorporating massage with the use of NSAIDs, so that would be they're used together with conventional medicine, whereas alternative health approaches would be more utilizing non-mainstream health approaches in lieu of conventional medicine, which is not a common practice in the United States. And another frequently used term is integrative medicine, which is a coordinated approach to combining conventional and complementary health approaches together. So I mentioned on the previous slide the National Center for Complementary and Integrative Health, or NCCIH. And in the United States, the NCCIH is a federal government agency. It's a subset of the National Institute of Health, whose mission is to fund and conduct research on complementary health approaches. So the NCCIH research model is pictured on the slide here. So let's kind of dig into this graphic to understand the scope of what's meant by complementary health approaches, which is really an umbrella term. So complementary health approaches are organized into two subgroups, which are pictured here at the center of the model. So in orange on the left, we have mind and body practices. So this would include things like acupuncture, massage, healing touch, Reiki, deep breathing exercises, etc. And in green on the right, we have natural products. So here we're talking about herbs or botanicals, vitamins and minerals like dietary supplements, and probiotics. And the dietary supplements in particular are very widely available and marketed to consumers without a prescription. The NCCIH studies the effects of mind and body practices as well as natural products within 6 dimensions, which are pictured around the outside of the model. So these include pain, interactions and safety, biological effects, mechanisms, meaning the mechanism of action, healthy behavior, stress, anxiety, and other symptoms. And I found it interesting, so I included it on the slide here. Given the large scope of their mission, like there's a lot in that in that graphic, the staffing and funding for the NCCIH seems to really pale in comparison. So for fiscal year 2019, the agency had a little under $150 million in funding and 68 full-time staff members. So that's interesting when you consider that, for example, the essential oil estimated global market for 2022 is over $11 billion. So in the US, there seems to be this mismatch of research funding for complementary health approaches versus consumer demand. So let's talk a little bit more about that demand. So how prevalent are the use of these complementary health approaches in the US? And we actually have a really great source of data for this when we're talking about, broad use categories in pediatrics and adults. So the National Health Interview Survey, or NHIS for short, is an annual study that's conducted by the National Center for Health Statistics, which is part of the CDC. And every 5 years, the survey includes a supplement on complementary health approaches. And this was most recently included in 2012 and 2017. And so looking at some data, 33%, so over 30% of adults and over 11% of children, which I'm imagining this was like as answered by their parents because it was for ages 4 to 17. They said that they used at least one complementary health approach. And the most commonly used approach was natural products, so those dietary supplements other than standard dose vitamins and minerals. And what's also interesting in the context of our patient population is that the usage of complementary and alternative therapies increases dramatically for children with chronic medical conditions. So conditions that affect their activities of daily living, such as cerebral palsy, and also conditions that affect their emotions, attention, and behavior. So like our ADHD population. And over 50% of children with a chronic medical condition reported using at least one complementary health approach in the past year. And in terms of spending, about 59 million Americans spend out of pocket on these complementary health approaches, with their total spending adding up to $30 billion a year. So, these things often are not, covered by insurance. So they're paying out of pocket for these things. And according to a 2018 Consumer Report survey, 1 in 5 consumers report that they prefer complementary medicine, and 12% say that they prefer natural remedies over, seeking a prescription from their doctor. So I think that, a key takeaway for all of this for healthcare professionals from the NHIS study is that as consumer use of these complementary health approaches grows, so too does sort of like a stigma around its use. So I'll explain what I mean. The majority of adults that reported the use of at least one complementary health approach, and particularly the older adults, said that they didn't discuss their choice with their physician or their healthcare provider. And they gave several reasons for that, including that they simply were not asked about their use, or they didn't feel that there was enough time to ask questions about their use, or they perceived that their provider would react negatively. And I'll come back to this because, interestingly, the provider perception differs. So healthcare institutions have taken notice of this demand over, the past decade or so. And at the time of a 2010 complementary and alternative medicine survey of hospitals, over 40% of institutions reported that they offered one or more complementary health approach. And then this number increased over the last decade, with one survey reporting over 60% utilization of at least one complementary health approach in 2017. And I'm sure that that number is higher today. And while use of complementary health approaches is becoming more prevalent in the United States in our healthcare system as a whole, the use really isn't standardized. And US-based research is limited because, again, going back to the funding, it's just not there in our country to conduct that sort of research. So in a 2017 survey of pediatric inpatient facilities, only one hospital reported having a written policy directing the use of their complementary health approaches. And the most commonly used therapies were massage and healing touch or therapeutic touch. And so over 30% of the sites reported using those modalities, but approximately 50% of sites, I thought this was interesting, reported that they allow families to administer some herbal preparations and supplements, but only 1/3 reported that they had pharmacy screening for the preparation. So they just, allowed families to, give these additional supplements or use these additional practices. So there are identified barriers for health professionals in the literature. And two researchers conducted a study of nurses, physicians, and allied health professionals at a pediatric women's care center. And I know that that's an older study, but just bear with me because their findings are consistent with findings in my study that we'll look at later. So earlier, we had the results of the NHIS study reporting that patients perceived that providers were not supportive of their use of complementary therapies. However, according to this study, caregivers self-reported that they were mostly supportive. But caregivers, while they identified that they were supportive of their patients using complementary health approaches, they felt that they had little scientific knowledge regarding complementary health approaches and struggled discussing these therapies with their patients. So it wasn't that they were judging their patients necessarily. Maybe it was just like their insecurity about discussing them that their patients were perceiving as judgment. So aside from the challenges limited caregiver knowledge of existing research, there are some barriers to implementing any practice change. So, especially staffing challenges and limited resources and, burnout. And, the vast majority of complementary therapies are not covered by insurance. So hospitals struggle to staff these positions when services are not billable. And, it's just sort of this icing on the cake. It's not really considered a priority. So we've laid some groundwork now to understand what is meant by the term complementary health approaches and discuss some basic data on usage at home and in the hospital. So now let's talk about some potential applications for complementary health approaches in the NICU. And a lot of what I'm going to discuss comes from two primary sources. So I just want to take a moment to introduce them. So one is this wonderful summary of the literature that was done in 2001 by Dr. Jamie Jones, who was a speaker earlier. And they really did a wonderful job in this study. And I thought it gave a robust overview of various complementary health modalities with theoretical NICU applications organized according to the framework of the NIH model at the time. So I've included the article in my reference list, and I do encourage you to look at it if you want more information. But I've reorganized the information according to the new updated model that I talked about, just so that it kind of fits with the graphic. I also pulled information from the SENSE trial out of the University of Washington at St. Louis. And SENSE stands for Supporting and Enhancing Sensory Experiences. And in the article I've listed on the reference slide, you'll find their integrated review of the literature and a nice summary chart of their findings on what sensory support therapies had substantial evidence according to gestational age. So I have that chart listed here for your reference and a picture of the landing page for information about the program. And I think it's actually hosted on another site now, but you'll be able to find it from there. Okay, so here we go. I'm going to go through these as they were organized under the NCCIH framework. And some of the applications will be more theoretical, meaning there's a mechanism of action identified in either an animal studies or adult peds human subjects for a given therapy, but no neonatal research yet. And other applications have some like pilot study clinical data that I'll discuss. So first, we'll look at mind and body practices, so that orange side of the circle. So aromatherapy is one of the more exciting therapies, I think, in terms of potential for applications in the NICU. And we can think of aromatherapy in the NICU in a few different ways. So we have mom's scent, mom's breast milk, the scent of her milk. Those have applications as a natural aromatherapy through skin to skin and breastfeeding. So scent cloths, part of Dr. Welch's family nurture intervention. An emerging use of aromatherapy is in pain and stress management using essential oils that are derived from herbs and flowers. And essential oils have topical application, which I'll discuss later. But here I'm talking about inhaled via an aromatherapy patch, which you can see on the Zaki hand next to that little baby in the picture. And a clinical trial actually was done in Kentucky a couple years ago that showed that the use of aromatherapy patches from a company called BioS, they did have investigational drug approval for that study from the FDA. So they showed that use of this patch, which provided aromatherapy with lavender and chamomile in their NAS population, showed a significant reduction in length of stay and a 40% reduction in morphine use. And so that's really just significant when you think about the impact that that would have on their brain development and minimizing their exposure to those medications and their decreased length of stay. Another aromatherapy study, lavender oil on infant vaccination pain. We're going to go into more detail specifically on that one later. But, could there potentially be more pain and stress management applications in the future? So touch therapies, our tactile sense is the first to emerge in utero. So certainly a lot of potential here for touch therapies in the NICU. Massage is probably the most highly studied, certainly with the neonatal touch and massage certification from Carrie Ann Weitzman. And it really has shown improved neurodevelopmental outcomes and decreased pain and stress and improved bonding. And there's a link there at the bottom of the slide. And massage was discussed in the Sense Integrative Review as well. Reflexology is an ancient healing method that's based on the principle that reflexes in the hands and feet are linked to specific organs, glands throughout the body. So the theory here is that applying pressure to a reflex zone would stimulate blood flow to a specific area or organ and increase production of endorphins or help eliminate waste. And reflexology is based on the concept of chi, or the flow of life energy, and that our chi can be blocked or disturbed, and that our reflexology interventions can balance that balance can be restored through reflexology. So theoretical applications proposed in the review from the San Diego group were that perfect reflexology therapy could be used in times of messiness or disorganization to help energetically group the baby, or perhaps to increase blood flow to the gut to aid in, say, like gastric motility. So although in 2010 they were talking about these applications theoretically, there are some emerging studies in the literature. So there was a 2019 study from Iran with a small group of infants, so an N of 31. These were babies with NAS, and they were randomized to either receive foot reflexology, then auricular acupressure, or vice versa. And they found that the reflexology was effective in decreasing scores, their NAS scores, and the acupressure was dose dependent. So a 15-minute session was not as effective as a 24-hour session. And you can find that full citation in the references at the end of the presentation. A 2015 reflexology study was done in Turkey with 60 term infants, and they looked at the effect of foot reflexology prior to vaccine injection, and found that infants in the reflexology group also had decreased pain on the FLAC score and lower heart rates, higher oxygen saturations, and shorter crying periods than the control group. And there are more, which I included when you go to the reference slide there. I put a lot of studies in there that I'm not going to, go through in the interest of time, but just as additional studies for you to read. So craniosacral therapy, so doctors of osteopathic medicine, DOs, those in pediatrics who practice biomechanical manipulation, this would be in the category of craniosacral therapy. So basically that labor and birth can produce like a malalignment of craniosacral structures, leading to altered function. So for example, strain in the occipital bones can induce nervous system dysfunction, such as hyperactive peristalsis, hypertonicity, irritability. And then through manual manipulation and myofascial release, the thought is that dysfunction can be avoided. And there was a 2016 study, a feasibility study done that showed that not necessarily that they weren't able to show a statistically significant benefit, but they showed no adverse outcomes, and thought that there should be some additional research into that. So energy healing. So acupuncture is part of traditional Chinese medicine, and it's an energy-based treatment. So centered on the concept, again, of qi, our body's healing energy. And our qi circulates throughout the body on specific pathways referred to as meridians. And when obstructions occur, disease results. So have that classic version where thin needles are inserted along these meridians, but there are also methods using electrical stimulations, heat, or laser. And acupressure is more popular in pediatrics because of its less invasive nature. So here, pressure is applied to acupuncture points. And in the San Diego paper, they discussed several neonatal applications, including auricular acupressure for drug withdrawal. So, such as the study that I mentioned on the reflexology slide, studies have also been done for colic, constipation, postoperative, like oliguria and pain control. And acupuncture is currently used in China for treating a wide range of things from jaundice to skin issues, teething, pain, ear infections. So a lot of broad categories. Reiki is non-invasive energy healing practice, and that involves the body's chakras. So the Reiki therapist will transfer energy through the hands to a patient with their hands over but not touching the body of the patient. And the purpose is to restore the body's energy to balance, relieving pain, accelerating healing. And in adult studies, it's been shown to calm respirations and lower blood pressure. And there are some Reiki applications. There was a 2018 study that was done in Ohio looking at Reiki for the treatment, again, of NAS, and found that it was a safe intervention for NAS and did show a small but not statistically significant decrease in NAS scores for the Reiki intervention group, but certainly some potential there to help with our NAS population. Healing touch is, I feel like everywhere I've worked, there's been a healing touch program. Maybe I'm lucky, I don't know, but I feel like that's one of the more prevalent programs available in the NICU. And again, this is an energy-based therapy that was actually developed by nurses and focuses on clearing and balancing the human energy system through touch. And it's, there have been studies from everything for depression and diabetes and cancer. So, broad use categories across the lifespan. But there's a nice integrative review of healing touch that was published in 2011 in the Journal of Holistic Nursing that I have listed there. So now moving to the other side of that NCCIH model, looking at research priorities, circle looking at natural products. So homeopathic medicine, or homeopathy, is a medical system that was developed in Germany over 200 years ago, and it uses diluted plants, minerals, and even animals like whole crushed bees. Homeopathic medicine typically contains a very small dilute amount of substances which would in large quantities cause symptoms of illness in healthy individuals. And while its mechanism of action is not understood, practitioners' clinical experience in some clinical trials indicate that homeopathy's tiny doses may provide positive benefits. So most people use homeopathic products, self-prescribe them for colds and musculoskeletal pain. The NHIS study that we talked about in the beginning of the presentation found that about 5 million adults and about 1 million children use homeopathic medicine annually. And of the 1.8% of kids that use homeopathy, only 0.2% actually went to like a homeopathic practitioner. And you can read more about homeopathic medicine on the NCCIH website. So then we have botanical or herbal medicine. So this is different from homeopathic medicine. So this is more of an ancient practice dating back to 400 BC. Substances were first isolated from plants and account for actually 25% of our Western pharmaceuticals. So another 25% come from chemicals that were first found in natural products. So example in the NICU world is caffeine, right? So caffeine is the number one selling herb therapy in the United States, and we know that we use it for apnea and bradycardia in our little babies. So herbals, botanicals are highly utilized. And as I said in the beginning of the presentation, they're the most used complementary health approach in the United States. And in Europe, Germany in particular, medical providers write tens of millions of prescriptions for herbal medications annually. So in the US, depending on the formulation or route of administration, botanicals can actually be considered food supplements, not necessarily medications, and some are considered cosmetics. So they're regulated under the Federal Food, Drug, and Cosmetics Act or the Dietary Supplement Health and Education Act. So it just kind of depends where they fall into. And you can access a wealth of information, including regulation information and research studies on botanicals on the American Botanical Society website. Some infant examples of use include chamomile and calendula cream for diaper rash and gripe water. That some parents buy that over the counter. It's a formula of lemon balm, fennel, and chamomile for colicky infants. So calendula is used in Russia to treat conjunctivitis. And this picture here is from Dr. Wheels, like a pretty prominent integrative health physician. And it's made like a calendula salve. So I have listed here an example study. There was a 2017 open randomized control trial done in Italy that compared the use of chamomile, melissa, and a probiotic alone, and simethicone in the treatment of colic. And there were 100 infants included in the study. And researchers concluded that the herbal and probiotic remedies were significantly more effective than simethicone. So essential oils are our next category there, and they're natural volatile aromatic compounds extracted from botanicals. And we discussed some aromatherapy applications already, but there are some topical and oral routes of administration that have potential benefits in the NICU. And certainly because essential oils are highly concentrated and potent, a lot of work would need to be done in order to establish safety and efficacy. But there's a great deal of potential for toxicity. So, that's not necessarily something that would be, taken lightly. But there are some studies out there that show safety and efficacy for particularly some topical applications. So colic is a common issue for babies, and there are a lot of complementary health approach studies out there looking at colic specifically. There was a 2012 study done in Turkey of 40 infants between 2 and 6 weeks of age with a gestational age of 38 to 42 weeks. And they showed that simple abdominal massage with a lavender essential oil decreased their length of crying time, which if you've ever had a colicky infant as a mom, any decrease in crying time is a win. So one of the default responses, I think, to most discussions involving complementary therapies in the NICU is, show me the evidence. So I wanted to just do a bit more thorough of a look at one of the studies I mentioned earlier. So this is a double-blind randomized control trial of 97 infants that was conducted in Iran. And the infants started lavender oil or placebo aromatherapy 1 minute before injection of the vaccine. And the pain was assessed 3 times using the neonatal pain scale before vaccination, 15 seconds, and 5 minutes after vaccination. And also the duration of crying was measured in both groups. And so 43 babies were given the lavender, and significant findings were that the 5-minute NIPS score and crying time were significantly lower for the group receiving the lavender. And the hope of the researchers is that possibly aromatherapy interventions like this could be applied routinely for pain control and vaccination and other invasive procedures for babies. So why would lavender reduce the pain? So let's look at that. So lavender oil is obtained from flowers of the lavandula, I'm going to say this wrong, angustifoli, I think is it, by steam distillation. So whole lavender oil and its major components, linalool and linalool acetate, are used in aromatherapy. And this photo is for the purposes of describing why lavender repels moths, which I'm not going to get into, but I thought that the graphic was good. So I want to focus on the top left there, the linalool. And linalool is a type of hydrocarbon compound that is produced by plants and gives them their smell and taste. So linalool specifically is a monoterpene. And so common physical characteristics of monoterpenes are low molecular weight, meaning they are small and light compared to other types of molecules. They're clear in color, free-flowing, so non-viscous, high volatility, and strong aroma. And so in chemistry, the word volatile refers to a substance that vaporizes readily, so optimal for aromatherapy. So linalool, being a highly volatile compound with a low molecular weight, is readily inhaled and absorbed. And when it does, it activates hypothalamic orexin neurons, so one of the key mediators for pain processing. So this is an animal study, which is upsetting, but the findings do help us understand how the linalool works in the treatment of pain. So in this study, mice who experienced a painful intervention first received linalool aromatherapy, and they were able to show that the linalool worked by activating these hypothalamic orexin neurons. And they concluded that analgesic circuits triggered by olfactory input may be inherent in the mammalian brain. So again, in animal studies, the number of orexin neurons reached adult levels by postnatal day 7, and they're fully functional by 21 days. So the infants, like thinking back to that infant study, the vaccination pain study were term infants at 2 months old. So sort of reasonable to think that the analgesic effects seen from the lavender aromatherapy could be from linalool activation of these orexin neurons. So this brings me to my survey. So, it was interesting to me. I never really had any exposure to a lot of complementary health approaches just in my own home growing up. And then, as an adult, massage, yeah. And like I said, therapeutic touch, but not essential oils. And there was this baby on my unit who was from the Amish community. And they use essential oils in their culture. Like they have an essential oil practitioner that basically you would go to with whatever health issue that you have, and they would recommend a certain regimen of essential oils. It seemed like a lot of topical things. So we had this baby, and the mom, brought this person in, and they really wanted to do a lavender abdominal massage. And it was interesting to me how strongly people felt about it one way or the other. I kind of thought, well, okay, like let's think about, is there any harm that could come from that? I didn't know. I didn't have the knowledge base to really speak to that, the safety of that. But people really just reacted so strongly to it, either negatively or positively. And I found that interesting and wanted to learn more about what people's perceptions were. And so sort of the idea of this survey started to grow in my mind. And then, finally was able, through my hospital's evidence-based practice fellowship, where I was at the time, was able to, develop this survey. So the goal of the survey is to establish 3 main concepts for each complementary health modality. So NICU clinicians, including physicians, nurse practitioners, physician's assistants, nurses, therapists, they're asked questions to establish what complementary health modalities they use in self-care, the care of their family, what their perception of the safety and efficacy of these complementary health therapies in the care of neonatal patients and their families, would be. And then finally, what's their knowledge base for discussing these therapies with their patients' families? Again, like going back to that common theme in the literature of that, maybe people support use, but they don't feel like they have the knowledge base to discuss them. So here I have a graphic showing the organization of the survey components. So the 3 main areas are the personal use, the perception of safety and efficacy, and the scientific knowledge base regarding the therapies defined under the umbrella of complementary health approaches described by that NCCIH model that we looked at. And the survey went live via a RedCap platform and was shared through the National National Association of Neonatal Nurses, as well as through physician and advanced practice nurse communities throughout the country. And actually, I had some international responses as well, which I thought was fun. So altogether, I received over 200 responses. So I think 260 total. So we'll go through some preliminary data. I don't have the like advanced statistics that Rochelle has that they're being worked on, but I just have some simple statistics to look at just as an introduction. So here are some demographics, and you can see that half of the respondents reported over 15 years of NICU experience, and just over half were staff nurses. About 48% were level 3 and 40% were level 4, meaning that, the vast majority worked in high acuity units, most with a mixture of medical and surgical patients. And geographically, the largest chunk were from the Northeast in that lighter teal color, followed by the Midwest in that darker shade of teal. So one of the three main areas I was interested in looking at was the personal use of complementary health approaches. So here we're looking at how comfortable respondents are with using complementary health approaches in their home. And the vast majority in the purple and sort of like magenta color, 33 and 35% respectively, report that they're very or somewhat comfortable with personal use. And now I ask about a variety of complementary health approaches, but I just, chose a couple here just because the aromatherapy I think is a particularly exciting area for the NICU, and then some topical essential oil related. So reporting home use of complementary health approaches, 66% report aromatherapy use at home, and 62% reported topical essential oil use at home. And then in terms of how comfortable they were with the use, you can see like that they're just about everybody, like we said, the somewhat and somewhat comfortable or very comfortable. There's, very little that were very uncomfortable, just that tiny little slice, which I thought was interesting. So here we're looking at institutional use of complementary health approaches. So just over half report at least one complementary health approach being offered to staff. 21% offer aromatherapy, and 4% topical essential oils. So 57% report at least one complementary health approach being offered to non-neonatal patients, and 58% to neonatal patients. And you can see the percentage of essential oil offered to non-neonatal versus neonatal is significant, with more being reported for non-neonatal, which isn't surprising. So 32% reported offering at least one complementary health approach to NICU families, which I thought was interesting, but very little aromatherapy or, essential oil offerings. And I know at one time we were offering like healing touch to parents, so I don't know if that is what they're offering. So here I asked respondents if they supported institutional use of complementary health in various populations. So across the board, NICU professionals do support the use of complementary health approaches. And looking specifically again at, essential oils, 37% considered aromatherapy safe and efficacious in the neonatal population, and 22% considered topical essential oil use safe and efficacious. So I thought that was interesting. I wasn't expecting as high a number for the topical, because I feel like, again, how many people reacted so strongly to the lavender massage from the little baby that I talked about. So now looking at that last piece, the scientific knowledge base. So here I asked respondents to self-report their confidence level in discussing the evidence-based risks and benefits of complementary health approaches. And over half are reporting that they're not so confident or not confident at all in their qualifications to have these discussions with families. And looking specifically at essential oils, 13% report that they feel confident in discussing aromatherapy, and 10% felt confident in discussing essential oils. So, those are some pretty low numbers. I mean, I guess they're significant numbers that, it's a large portion, but still like not the majority, certainly. And finally, we see that 26% reported formal training in at least one complementary health approach. And I think that that's a large portion of those people are massage certified. So this quote really spoke to me from Dr. Jones' paper, and it's from Nadine Cassidy, who's a nurse in the San Diego Children's Hospital. And we've focused for so long on sort of like the big technology, right? So there's like ECMO and high frequency ventilation and liquid ventilation and all of these things that are just amazing and absolutely are saving lives. But I don't really feel like the personal, holistic, hands-on approach that really speaks to me as a nurse that I think are really the soul of nursing, I think. So I hope that you thought that this was an interesting topic. And like I said, there are references here, like additional papers that you can take a look at. But that's all that I have. Anybody has questions?
Thank you, Sarah, for another great presentation. So if people can continue to put any questions into the chat, and then we can relay them here. Our NICU has signs that discuss aroma-free NICU, and families and staff are asked not to wear perfume or scented lotions. How do you introduce aromatherapy when these have been the guidelines?
Yeah, and so I think that there's a big difference between artificial scents and aromatherapy via these natural products. So like fake lavender smells, like people that have like scented candles and things like that might be really sensitive to that lavender scent. But then if you're actually using aromatherapy with a lavender essential oil that's a naturally derived lavender, it's very different. So I think that absolutely we should not be like lathering on like perfumed lotions and things like that. But this is a very controlled dosage of that aromatherapy. So these patches that were used in that NAS study in Kentucky had a very specific dosing of that aromatherapy that I would be surprised if anybody took offense to the scent of it. But I think that's a huge barrier. It is, but I think that it's one that can be overcome with education about the difference between artificial scents and essential oils.
And also very controlled.
Yes. Yeah.
What scents we're offering to the babies are very, controlled versus the variety of lotions and perfumes and things people could choose to wear themselves to bring into the unit.
Yeah, and I do think that tide is turning, because even just over my years that I was at Nemours, like I had that experience with that Amish family pretty early on in my career there. And then towards the end, when I was doing some of my clinical rotations, I did it with the general surgery group, and they were very interested in looking at a study with those patches that the Kentucky group used for our post-op patients in the NICU, like looking at if we could identify a specific population, like our gastroschisis babies or something like that we could try and see if we could decrease the morphine use in those patients.
And Cindy said, thank you. That makes a lot of sense. She was the one who had posed that question.
Yeah.
Jacqueline is saying she's interested in lavender and pain.
I think going through that, sort of explaining what the mechanism of action would be in the brain, it makes a lot of sense that, there is a real scientific base for this, and that we could really minimize the pain and stress and decrease that toxic stress. Like this is just another tool that we could have in our tool belt to help minimize their exposure, to morphine, and then to mitigate the pain and stress through a less harmful mechanism.
Liz Zimmerman is saying, Sarah, love your topic. Do you think pharmaceutical companies and their ads hinder the use of other therapies?
Yeah, I mean, it's a huge barrier in the United States, and I definitely would encourage you to go to the American Botanical Society website and read some of the articles that are on there talking about just the misconception. Like it's really almost like propaganda that it's an unregulated industry and that these therapies aren't research based, because there is research out there. It's just our country is not funding this research like it needs to be, but the studies are out there, and the use is much broader in other areas of the country. And I don't think like with I don't know that with our healthcare system and the statistics on outcomes in our healthcare system, like maybe it's time that we not be as judgy about what other countries are doing and start to pay attention to that.
Sarah had a question for you. So,
yeah,
with the one conference, we're always about people finding their one thing. And I know you're really into quality improvement projects. And so if somebody was kind of inspired by this talk specifically, and they were looking for one thing where they would start, where do you think the most evidence exists if they wanted to take kind of complementary things to the next level in their unit?
I mean, I think it would be hard to argue against the aromatherapy. So I think that the fact that they were able to have a clinical trial, again, they had investigational drug approval in the neonatal population from the FDA. Mm-hmm. I would definitely go that route. And like I said, I think depending on your institution, I think that it's becoming more acceptable, and physicians are more open to these complementary approaches. And certainly, like, a lot of people are using them in their home. So I don't feel like it's as big a stretch, for them to consider it in the hospital. So if I were to pick one project, it would be the use of those patches in for a pain intervention, whether you wanted to do it with heel sticks or with, your vaccinations, or I think heel sticks would be an easy way to go with that, because, I mean, and this is like a whole different argument for why we have to do them at like 4 a.m. when the parents aren't there, but like, that morning lab.
So true.
But at any rate, this could be an intervention to, help support babies through that painful procedure.
Yeah, absolutely. There's a question here about the patches, or were they actually used in neonates? And do you want to put that or say that reference again and give a little bit of a descriptor about the population in that study where they used the patches?
Yeah, so it was in Kentucky. It was a clinical trial in Kentucky. BioS is the company that had the investigational drug approval. So these were neonates. It was for neonatal abstinence syndrome. And the patch is not, it wasn't on their skin. So it's like a hydrogel backed patch that was placed on the Zaki next to the baby, and would just give off that pharmaceutical grade, that very controlled dosage of lavender and chamomile.
Katie Martin says she loves your presentation. Do you know if there are places out there to learn reflexology for infants?
I'm not sure, but I think that if you went to I would go to the NCCIH website and look on there for research studies and then go that route. I'm not sure if there is a certification or anything like that for reflexology.
Latoya's asking, is there a specific dosage based on gestational age for natural oils such as lavender that is?
So the patches that in that clinical trial, it describes what the dosage is in the patch that they use. I'm not sure if she means like topical dilution. That's a little more controversial, the topical dilution. But you can, like, the colic study does talk about what dilution they use. And that's in the references if you want to look at that paper.
And do you know offhand for the BioS study with the patches, what gestational age were the patients in that study?
Yeah.
Someone's asking.
I can't remember. They were definitely term or near term. I can't remember what the minimum gestational age was, but again, like think about, so scents, there are noxious scents. So like an alcohol pad near the face, like that's a noxious scent. But the purpose of their study, they showed that the aromatherapy patches, minimize the pain and stress of the NAS. But yeah, I would say they had to be term or near term babies.
And it looks like Kathy's saying she thinks that they might have been NAS, so more term.
Yeah.
And Cindy's commenting, we will have to try this with our NOWS babies with the Eat, Sleep, Console program, and it would be helpful for baby's mom too.
Well, yeah, even and mom could have the patch on her, right? So then they could both be getting their aromatherapy. I think that would be amazing. I think that would be a great project. Yeah. And it would probably be an easier sell, honestly, because because then you're like, oh, we're going to put it on mom and the baby's going to be near mom. Like, I feel like that would be a shorter bridge to cross than just having the baby.
Directly to the baby.
Yeah.
Sally Hasten is asking, what about scented pacifiers? What about the influences of caregivers wearing the essential oils? Does that affect our babies? So that speaks to potentially putting patches on moms with the Eat, Sleep, Console method.
Yeah. I think it does. I think that, it absolutely would have an effect. Just any scent that the baby is near has an impact on them, either negatively or positively. So you could wear the patches yourself and do your own project. See if your babies are the calmest babies on the unit.
She does say, I have known some of the oils to have very strong scents and potentially offensive to her,
for sure.
Concerned about too much for nurses or patients.
Yeah,
so it's picking the best ones.
Yeah, absolutely. And and there are people that are more sensitive than others, but like, again, these are dosed patches. So it's not, I don't think it's as strong a scent as maybe she's picturing.
Yeah, I feel like when you wear a patch, it's not as noticeable to those, just being in your general area. You can smell it yourself, and if you're holding a baby, but not to those in the room with you.
Yeah, it's definitely not.
Any other questions for Sarah?
Great job, Sarah.
Thank you.
Okay, everybody, wasn't that an amazing presentation by Sarah? And thank you to all of our moderators and participants in the 2021 conference who were there asking questions at the end. I hope that this really did educate you about the differences between complementary and alternative medicine, but also really open your eyes to what's already been studied in the NICU and what's possible that you might want to implement in your unit as well. If you'd like to get more information, I would recommend that you either scan the QR code here on the screen or click the link in the show notes below so that you can get access to the slides from this presentation and weekly reminders when our presentations go live. And if you haven't already, go ahead and subscribe to our channel. It really helps us to be able to bring you more free content. So I hope that you will stay tuned for more videos in our Caring For and From the Heart series this month, in honor of Valentine's Day, February 2024. And if you've missed any of our past videos, go ahead and check out our channel. We've got dozens and dozens there for you, from everything from cooling to small babies to HIE to IVH, you name it. We are your go-to place for free education online. So I hope that you will enjoy these presentations all month, and I will see you next time.